Thank you so much for staying tuned. It's still the conversation here on Lagos Television. And of course, on this segment of the program today, we're commemorating a day today. And every 26th of September is celebrated as the World Contraception Day. And of course, today is also one of those days to raise awareness on issues around contraception, family planning, and a host of others. We do know that, this topic is one that is timely, because some women will tell you, no, I don't even want to go through the use of contraception at all because of personal reasons or because of reasons best known to them. But what better way can we share the news, and can we tell them that, you know what, this is your choice and it could also be your future. So you need to choose right. We have guests this morning, and together we'll be taking a look at the celebration or the commemoration of this year's World Contraception Day. Dr. Latifat Adeleye is the Coordinator, Family Planning, Lagos State Ministry of Health. Thank you, Dr. Adeleye, for being here on the program today.
Thank you.
And then we have Princess Temilola Olorode. She's the Clinical Training Officer at MSR Nigeria Reproductive Choices. Thank you, Princess, for being here on the program this morning. Doctor, let's start with you. Let's quickly tell our viewers, what are contraceptions? Because again, it feels like a lot of people do not necessarily know the meaning of contraceptions and why they are useful or why they are important.
So contraceptions relatively are things or methods which you use to delay childbirth or to space your children.
Okay.
So it's not that you don't want to have the children any longer. It's just that you don't say, I'm not ready now. I'll be ready in 5 years' time. I want to do something now. Or I probably don't have money now, but I'll have money. So it helps you to plan. Okay. Oh, I think I'll be able to take care of 2 children. Let me be able to sit down and plan for 2 children. And this is how I want. So it gives you an opportunity. So contraceptions are those methods, and they are variable. So they come in different ways. They could be hormonal. They could be mere barrier methods. Okay. They could also be surgical.
Right.
Okay, and it could just be simple, using your calendars, using, as we use a cycle bead now to use that to help you count your period.
Right.
And it's just, those are the methods. So it's all of them are all contraception, and they all make up what we call the mother contraceptive method and the mix pot. That's right. So the method mix. So this to give different people different opinion, because we are all different. What might be good for me might not be good for you.
Right.
You're expected to have your safe period, and expected that when you are ready, maybe when you are supposed to have your ovulation period, you are supposed to have, you'd have planned with your husband. But some people have their ovulation period within their menstrual period.
So these are things
that okay, that kind of person now, obviously that kind of method won't be good for her. So you'll be good. She might obviously prefer another method, and then you look for the other choice that will suit her using the required guidelines that has been stated.
Right. Before we come to Princess, Doctor, contraceptions, well, I'd like for you to also help us clear the air here. For contraception use, is it just for the women?
No.
Thank you.
Sorry, no. And
there's a need to state that fact, because oftentimes people just assume it happens to a woman.
No.
Okay.
So this is it. Contraception, family planning. It's about 2 people.
Right.
I'm not going to say husband and wife, because you don't necessarily be married. Yes.
Right.
You could be in a relationship and you'll be like, no, we want to plan how we want to live our lives together. So it's 2 people. The male and the female, the man and the woman. You sit it down together and take a decision. There are many contraceptive methods. I hear now that they are bringing out the hormonal contraceptive methods for men. I am waiting. Yes, they are working on it.
Are men ready to take
Well, that's when it comes, we'll talk about.
When we get to that bridge,
we'll cross it. I've had discussions with them that they say they don't mind, because a lot of our men don't like condom. You know, contraception, condom is for men.
It is, yes.
So they don't like condom. And then you also have vasectomy. That's a surgical one.
that's another conversation entirely.
We have people taking it up.
People are beginning to take vasectomy. Oh, wow.
Exactly.
Okay.
We have clients walking up and telling you, this is what I actually want. I want a vasectomy.
And men they are
getting up to that level. Oh, wow. I mean, because again, when you hear cases, there are case studies that you can allude to, and then you are saying men are actually coming up to take up. So in that regard, please take us through what are some of the things that you've heard, some things that you've heard women say to you on this job that you'd like to correct this morning, because there are times that sometimes it is just a miscommunication or somebody is just not telling you the right thing that would make people have the fear or the phobia for wanting to access any of this family planning method. So please take us through what are some of those things that you've heard women say that you'd like to tell us this morning it is not the truth.
Okay, thank you very much. We have had women tell us about their husbands that they don't want them to take a family planning methods. And by the time you reach out to the husbands are actually willing. So they have seen their husband's perspective as an umbrella to hide on. And yes, that has been that we have had that over some time. Okay. Also have people taking up IUD, and they also tell us that when they have the rope, they're having itches on the rope and all of those things, and it's not correct. The case, that scenario I've had that a man brought the wife to the clinic and said, please remove this IUD for me. Wow. Because it is pinching me. And we got inside and the woman said, no, I don't want it removed. Please, can you please leave it there for me? And they went to. And months after, there was no experience of such, and the IUD is still in place. Oh wow! Usually, when you take up contraception, it's possible you have irregularities in your menses, a menstrual cycle. So much side effects. And that one of the side effects that we have, but it's manageable. Some women will not even experience any irregularity. So it's a common thing that people want to run away. But for those experiencing that, I just want to tell you, please go back to the clinic where you take it up, and there is always a way to regulate it.
Joy?
Okay, so I want to take you up on there so are you saying that it's not normal to experience irregularities when you are using any of these family planning methods?
It is possible you have changes in your menstrual cycle. It's either it is shorter or it is longer, or you have spotting in between. It's a side effect that can be managed. Just like you take any other drug and you have side effects taking it, and tell you to do this and do this to reduce the side effects. So contraceptives they are also like any other drugs that we are taking. So once you experience side effects, there is a way to manage it.
I want you to also talk about the various methods and how it applies to women.
Okay, so there are various methods that we have, just like Dr. Latifa told us when she was starting. We have the hormonal methods and the non-hormonal methods. So for the hormonal methods, we have the long-acting methods and we have the short-acting methods. So for the long-acting method, we have the IUDs, we have the IUD, HIUD, which is an hormonal IUD. Okay. And we also have the implants, we have the injectables, we have the oral pills. So when we talk about the short-acting method, those are the injectables. They fall under short-acting method. We have Depo for 3 months. We have Ciana Press, DMPASC, also for 3 months. We have the Noristerat, which is for 2 months. So those are the short-acting method that you could take up when you are looking at a short time frame.
Spacing.
Okay.
And each of these methods actually depends on the individual.
Exactly.
Because no matter even if it's short acting or long acting, it might not be suitable for your person. Okay. So using the MEC wheel, which we give all our health providers, there's a proper and balanced counseling. There's a discussion and proper counseling where you are asking questions with the client. There are certain questions you ask client to be able to ascertain which of this method is actually
best for you.
Best for this client.
So we call it life preference.
Oh, okay.
Lifestyle preference, whatever your lifestyle and whatever you want. So because we have varieties that we can choose in. Right. Can choose from.
So
varieties.
It's not that
it's not a one size fits all.
It's not a one size fits all.
It's not.
And it's not for you to say because someone went and had an issue.
I should have that one too.
And the person didn't come back to the facility to ask
questions or make a complaint.
and then to be attended to. And the person now, you now hear and you're assuming that's your own story. No, it's not your story.
And it applies to you also.
No, it's not your story.
Especially the implant. I've heard people say, oh, it causes palpitation, causes headache.
Because it's weight gain.
Funny enough, this is the first time I'm hearing it causes palpitation.
Palpitation. I'm also hearing
headache. Wow. Generally, it could cause hypertension in some people.
That are predisposed.
Exactly.
I love that word. You use the right word.
Exactly.
Some people are predisposed. So when you are using the mercury, while you are counseling that client, you would have ascertained that this method is not good
suitable for this person.
And there are other methods the client can choose.
Right.
There's the barrier method. If the person doesn't want the barrier method, you have the calendar method. If the person doesn't want there's mere copper tea that has no hormones in it. Right. The old one that our aunties use.
And it's still available.
And it's still very much available.
So sometimes also, I've heard health practitioners also say sometimes patients or clients are also not truthful with their health history, and that also could cause a misguidance on what to use or what kind of method to suggest for such persons. So how important is it for people who are also seeking help to ensure that, questions asked, they give the correct answers so that the right method will be suggested to you?
Okay, thank you very much. And that's what we said. It's also important. Let me use the opportunity to tell people, let's go to qualified persons to pick up methods.
And based on that, I'm going to chip in here. So in Lagos State, we have 348 facilities in
the health centers
with trained, seasoned health workers.
Exactly.
Trained, seasoned health workers.
Okay.
Properly monitored, trained by the state, monitored with all the methods available.
Right.
All the methods are available.
All the methods. So I sit there, I work with MSN Nigeria Reproductive Choices.
Okay.
And I'm supporting.
That's an NGO?
Yes, and I'm supporting the state in ensuring that we have qualified, trained personnel in Lagos State to give services to our people, quality service to our people.
I like this particular one that you said, which will bring me to a particular video. I remember that we talked about that. Although it trended on social media, where it emanated from was not really stated, so we wouldn't know if it was in Lagos State, where a group of secondary school students were said to have had access to the contraceptive, is not implants.
I saw
yes, you saw the video as well. And so this again tells us why it is important to access only qualified individuals. But if you take a look at that, if it had happened rarely, how dangerous is that for young children, I mean teenagers, to have had access to implants at that age?
Okay, now talking about that, we have teenagers actually walking up to the clinic to take up methods by themselves because they are sexually active and they don't want to get pregnant.
Okay.
And contraceptives is for you to ensure that you finish up what you are doing. Is it schooling? Is it learning trade? Is it your business? You want to focus on your business and yet enjoy your sexual intimacy. So when a young girl walks to a clinic and says, I want this method, that means she actually knows that she needs it.
Okay.
And such persons should not be denied.
Even with that.
So with that,
when we have young people that come to us, we have youth-friendly clinics across Lagos State.
True.
Lagos State is very strong on young people and reproductive health, where we have seasoned health workers, both nurses and doctors, available to counsel and provide services to these young people. So they come in and they will talk to us. And sometimes part of the counseling relationship, we encourage them to bring in their parents to meet us. And when the parents come and we're able to counsel both of them, when parents get to find out that those kids are
sexually active,
they now say, oh, they step back and then they pick a method. So for us, a young person picking a method, and you as a school that is supposed to give guidance, see that, the first thing I expect you to do is to call that student and try and counsel first.
Okay, and then maybe even ask, how did you come
across
get to know, because we have no information whether the parents
is aware
or
not.
Okay,
have
they
given
gave consent already,
or is aware that this child actually has their method. That's your first. It's not even your business. Your business to find out from the child, are you okay Is your mom aware? Do you have any issue? No.
Okay,
you are okay. Hey, is there the consent? Is there anything you want to talk to me? And the child opens up.
Okay.
So how does this now relate with our culture and morality? I mean,
So now let's go back to reality.
So can you permit me to share a story with you?
Okay.
Thank you. That was a woman that brought her. I said, this girl, the way I'm seeing her,
She's already
active. And please, I don't want her to. I'm a single mom, and I don't want her to get pregnant.
Okay.
So they brought her. I said, okay, that's fine. When daughter, what do you think you want to pick up a contract? Because we also need to ask them
if they really want.
Yeah, exactly. If they want, do want to, they said yes. So by the time we did a pregnancy test for this girl, she was already pregnant.
Oh, wow.
The mother collapsed. We have to leave the child, resuscitate the mother, and ask her, please just calm down.
Which was what she was preventing in the first place.
So this shows us that some of these young adults, they are already sexually active.
I like the fact that you said, let's come back to reality. Reality is that these things are happening.
Exactly.
So we shouldn't shut our eyes to it.
And then not protect these young people. Because part of this, one big part of the family plan is the counseling part.
Exactly.
And in that counseling part, you're going to be talking to that child to protect herself or himself. And the ABC of protection is always our first counseling right.
Exactly.
So you need to know how to protect yourself sexually, how to avoid getting raped, putting yourself in the wrong circumstances, or exposing yourself to all the vices that these young people are exposed to. And then you will now say, okay, for this, what is your plan? How do you want to do it? Do you have a boyfriend? Do you don't want to get pregnant? You can bring your boyfriend. And I'll go back to very popular movie that we used to watch, the Sugar Program. It was sponsored by the state to be able to get to the young people about what the real things are and how we should approach them.
Right.
So for me, let's be realistic. We have a young, strong, vibrant population, which is a huge part of our population that we need to support to grow, that needs to grow and be productive. So part of this family planning is also an opportunity for them to be able to take a choice, focus on their goals, empower themselves, and have a family that they can give all to.
Right.
And when they are ready to start a family.
Are we taking this message to the grassroots? How aware are the grassroots population?
Yeah, we have mobilizers in Lagos State. Across all the LGAs, across all the LCDs,
our wards,
the facility that
so you have your ward focal persons, part of all these our community activities. We have people that go around counseling, talking. We have some male involvement, but we want to do more.
Right, because again, I mean, that's the question, to do more. Because
we want to go everywhere now.
Right.
We want you to give us more of this opportunity, regular opportunity to have conversations. Let's talk.
Right.
But what do you want to ask? What do you think you need to know? This is what should be.
What are some of the questions that the people at the grassroots would ask? Because again, sometimes access, awareness, information is very key. And I know that sometimes also they worry about the fact that if you've used any of the methods, perhaps for spacing, is there, are there cases where when you're ready, and then it doesn't happen? Are there side effects of some of these methods that you've mentioned?
Okay, usually we have there is return to facility. So during our counseling sessions, we told them, we are picking up on hormonal method. There is always a time frame for return to fertility. When you stop it, this way. For the implant, return to fertility is immediately.
Okay. Because
once the rods are removed, there is no hormone being dispensed into your system, and that ends. So for injectables, we ask them. So return to fertility is around 3 to 6 months max.
Okay.
So if you intend to get pregnant in June, you could stop taking your contraceptive method. You stop taking that injectable by January.
Okay. To give you time.
To give the body time to return to fertility.
Okay.
And once that is done, and you start ovulating, you get pregnant.
Doctor, you were going to add something to
that? So what I was going to add is that, like we said, mind you, with this, everybody is different.
Sincerely speaking.
So when you stop, be patient. This is what's expected. There might be other things that could cause some delays. So you be patient, you work with your provider, and you wait to get max between a year.
Okay.
You should be able to take in.
If there are no
If you
other
don't have any
options.
other hidden this thing.
Right. Right.
should be able
Another
to-
question: can these contraceptives fail? Because I have heard cases of women who had the coil and then,
Our baby
And then they bring it out and
when you go for scan, you see the thing on the baby.
or some you
So
they are failure rates.
Yeah,
They are
But apart from it, let's even say they are failure rates.
Okay. So,
So
it's not
it's not
100%
100%
guarantee.
Abstinence is 100%.
Okay.
Once you know you are not doing it, there's no way.
And that's what we also tell our youth. That's the first thing that we discuss. Abstinence. But once you know that you cannot abstain. So different methods have different failure
Failure
rates,
rates, yes.
different rates of
Success rate.
effectiveness.
Okay.
So when you are taking up a method, we
couple
also
counseling,
discuss
yes.
this with you. We have some that are 93% effective. And you already completed the number of your children that you want. You cannot go for that. When you tell we have more than 99% effective,
okay.
and we have 93% effective.
Why would you choose
and your
93?
family is already complete. You don't want any
mistake.
Any mistake. You cannot go for 99. So that's why you say, please access care from government hospitals. And our green dot, the green logo, is in all the hospitals in Lagos State, all the clinics in Lagos State that offer FP. Please look for this green dot.
Okay.
And then access care.
Doctor, we'll
Yes,
still go
please.
back to the success and the failure rate of some of these things. So which means that of all the methods, like you said, abstinence remains the most consistent of all the methods. But from all of these things also, some of these methods that you've mentioned and the fact that it is not a one-size-fits-all for every individual. How then, so if peradventure I go to one of the facilities and we've spoken, they've asked me questions and they say, okay, you know what, I think the injectables are the most appropriate for you. And I say, no, I don't want. I want the hormonal or I want something else. At that point, what does the healthcare practitioner do? Go ahead to do what I want or go ahead to do what they feel is
so
most appropriate?
It's your choice.
It is my choice.
And then we also have what we call counseling for choice. When you have such a client that has on the method and you've advised her this is what she wants, sometimes some of those other methods are really bad for you. You can sign
A
a
consent.
consent form that this is your choice.
Okay.
And you'll be giving your choice.
Right.
Family planning is your choice.
It is
I
not.
cannot give you a
you don't force
method.
it on.
Yes.
No. We only take
You
you
only
through
advise.
the advantages
Yes.
and the disadvantages,
And
the
ensure
side
you
effects,
pick
what
what
to
is right
expect
for you.
on that method. And
It's
you
your
pick on-
choice
Yeah.
to say I want family planning, to say this is the method I want, and to say I will ensure I'm on the method because I have these goals and these are my plans and what I want to achieve. It's your choice.
So let me also add to that so when we have clients like that actually telling us this is what they want, we put them on a regular checkup visit. If they know they are at
I hope
risk,
they will open their gates.
if they know that they are at risk, they do.
Okay.
So okay, you are taking up this method using our MEC the medical eligibility with the WHO tool that we want to, it assesses your eligibility for all
the type
of those
of method,
methods.
yes.
Okay.
So when you fall into the group that
maybe-
needs you to come for checkup, so we tell you, since you insist on having this method, we need to see you regularly
Okay.
to ensure that you are not at more
Risk.
from the contraceptive that you have decided to take up.
Right. Before we allow you go, the theme for this year, of course, empowering choices, your future, your control. And you said just minutes ago that it is your choice. No matter what it is what you want as an individual. Please would like for you to again educate our viewers based on the theme for this year, the fact that, it is not something that we lord over you when you come to those facilities. It is still what you want at the end of the day. So that shouldn't scare people away from coming to the facilities.
And it's a facility is something to make you to achieve what you want to achieve in life. It's to empower you. And empowering you as an individual, we're empowering the community. We're economically building a healthy environment, a healthy community, a healthy state, a healthy country. So it's to say my goal. Okay, let me put my goal. I was an orphan at a very young age with 8 siblings. And I looked at it that, I cannot afford to get married too early. I want to finish my medical school, become a doctor. And as I'm going to school, I want my siblings to go to school as well. So by the time I'm finishing school, we're all at par. And that was what I did. And I focused on it. It was not about having any boyfriend or getting myself into trouble. I had a goal. I saw it through. I can say right now, all of us are educated. All of us are doing well. We're stable. That's the essence of you making a choice because you have a goal. Because you want to be what you want to be. That's what family planning provides for you.
Right.
It's all about your choice. You come to us, we will enable you to achieve your dream.
Your goal.
That's what it's for.
Okay. Joy, any more questions from you? Okay. Right, I think we'd have to leave this. Is it free?
Please, it's very free in Lagos State.
Yes.
I mean, let's quickly also clear that.
Let me say it's very free.
Very free.
There is no charge to the commodity. But, as you know, if you go to our facilities, our primary health care facilities will really not collect money for consultation. The secondary facilities can say you should pay for consultation fee.
Okay.
That is a different service.
Right, but the primary health, the
it is
PH
not
says
that this is the family planning service that you are paying for.
Okay, okay.
The commodity itself is
It's free.
The government is spending a lot of money, providing, ensuring. The government and partners, donor partners together, are supporting they are supporting the state to ensure there is regular supply of commodity at the state warehouse. It's also ensuring, like we told you, training, ensuring that other things you have to be able to do, to move the commodities from where they are stored to the service to you as a user is available.
Right.
All this costs a lot of money, and the government is doing it.
Okay.
It's available for you. Please.
All you need to
make
do is
a
just
choice and go there now.
Exactly.
Okay. And look out for the green dots.
Yes, the green dots, please.
Okay.
That shows family planning.
So you could see the green dots. Yes,
that
these are the
facility.
facilities so that I've mentioned. You could see those green dots at certain pharmacies.
Yeah, that's another thing.
Yes, so we have pharmacies
that
can offer you some services.
Some.
Yes, not all.
Not all.
You could see it, and they will some of them could cancel you and refer you to the site where you will get the choice or the method you want.
Okay.
So please, the state is ensuring it's available everywhere.
All right, thank you so much, Princess Temilola Olorode, Clinical Training Officer, MSR Nigeria, Reproductive Choices. Thank you for your time on the program today. And Dr. Latifat Adeleye, Coordinator, Family Planning, Lagos State Minister of Health. Thank you so much for coming on the program today. Well, we've heard it from our guests this morning, and three things I've picked out here today. It is your choice. No matter how hard or bad it is, all you need to do is present yourself, be truthful with your health history, and let them tell you all that you need to know. But at the end of the day, it is what you want. You might be made to sign a consent form anyway, but it is your choice. And of course, thank you so much again for being here on the program today. The green dot is also very important, and also ensure that you only patronize government facilities that have all of the care and attention that you need. We'll take a quick break. When we return, one more conversation we have before we say goodbye on the program today.